thank you all for being here. It was the day before our beautiful little girl's second birthday when she was diagnosed with Mucopolysaccharidosis, type 1 hurler syndrome. It is a devastating genetic disease for which there is no cure. In Australia, there are around 12 children with MPS 1 hurler. From diagnosis, it became a whirlwind of time-critical treatment. Less than 3 months later, she had undergone 2 surgeries, 9 hospital admissions, and my husband, myself and Kaitie had moved from our home in country South Australia to Sydney so that Kaitie could undergo a life-extending bone marrow transplant. We were in Sydney for over 3 months. Kaitie is seen regularly by 17 different specialty medical teams, most of them here in the Women's and Children's Hospital, which is a brilliant medical centre. I have held Kaitie down while she has been anaesthetised 18 out of her 22 surgeries to date. I have driven her to the Women's and Children's Hospital over 100 times for almost 300 outpatient clinic visits. This equals about 53,000 kilometres driven for the sole purpose of hospital appointments for Kaitie. Thankfully, the appointments have thinned out and I am able to amalgamate them. And at the moment, we travel to Adelaide about once a month. While we still wonder how much simpler our lives would be without MPS, I know we are so much richer for it. People we have met along the way hold a special place in our hearts and lives, be they doctors, nurses, scientists, friends with special needs children, or fellow MPS family members. These are people we would never have met without MPS in our lives. And yes, while life with MPS is monumentally hard at times, I consider ourselves very lucky. Firstly, that we have such amazing and supportive family and friends, especially my parents, who help us when we need it and support us always. Secondly, because Kaitie has had access to treatment. While it is not a cure, she simply wouldn't be here anymore without the treatment she received, enzyme replacement therapy and a bone marrow transplant. She was able to access the best possible treatment available for her condition. This is not always the case for MPS patients, which is why the Life-Saving Drug Program, or LSDP, must remain responsive to the needs of all types of MPS and other rare diseases. I hope that one day in the not too distant future that all children with MPS have the same quality of treatment available to them so that no parent has to watch their child suffer and die like our friends do. Kaitie is now 9. She loves Pink and Ellen DeGeneres and thinks they'd be great friends if she got to meet them. No idea how much I wish I could make that happen. Last year, I was able to take her to the Pink concert and she loved it. Kaitie enjoys school and is a social butterfly, but she would still spend all day on YouTube singing and making loom bands if you let her. Her little brother Alex, who is also here, is 5 and almost the same size as Kaitie. But Kaitie likes being small. She figures it's easy to fit into small places. And she can just be Alex's little big sister. He is very protective of her. I would like to thank Genzyme for bringing the book to fruition, our brilliant MPS Society Australia for their assistance and support, Amy Russo, the author who has made the trip to be here today, Karen Erasmus for her amazing illustrations. But most importantly, I want to thank Kaitie for being the inspiration for the story and my life. This book is Kaitie's story, but the book is also so much bigger than Kaitie's story. This book will give every reader a tiny glimpse into the world of a family living with a rare disease. The diagnosis might be different, but the isolation felt by the families of 1.2 million Australians diagnosed with a rare disease is alike. Everyone needs understanding and hope, and I sincerely believe that that's what this book can bring. Thank you.